I didn't have any major symptoms, which I guess it's kind of called the silent cancer because people don't have a lot of symptoms. I had had some changes in my menstrual cycle, occasional little backache, nothing major at all. I had my yearly physical in July. My OBGYN at that time said everything was fine. I was healthy, no problem. And then I was having some problems with my bladder, though. I was noticing I was having a little bit of pressure on my bladder. I'd always had some little issues with it just after having a child, but then I was noticing more pressure on it. So I thought, well, maybe it's time to get that checked out. So I asked to see a bladder specialist. I actually was recommended to see Dr. Mary Janelli at Rex Hospital. And when she did the exam, she found that she said something doesn't feel quite right. It could just be a cyst on your ovary, but let's get you an ultrasound and have that checked out before we move along any further. And when I had the ultrasound, that's when they discovered the 9-centimeter mass on my right ovary. Of course, they still thought that everything was benign because of my age, because of my size and that type of thing, that it would be okay. But it was big enough that they would have to have it surgically removed. So they got me an appointment with a surgeon. And I guess it was a couple months before I went in to see the surgeon. And at that time, they did run some lab tests. They did a CA-125, which is a tumor marker for ovarian cancer, and it did come back about 300, which I think under 34 is normal. So that, it was a little alarm that went off. So they said, we need to go ahead and get you in now, just in case. And I went in for surgery in October of 2009, and that's when they did find that it was cancer. They classified it as a 3A, which means that it had spread somewhat to some other organs, but it was still pretty limited. It had spread to my intestines. They had to resect part of my intestines and scrape my bladder and, of course, do a full hysterectomy. But it turned out that they were able to get all visible signs at that point, which was good. So after the recovery of that, then that's when led to the road for the chemo. And I met with Dr. Van Lee. She did my surgery, and I've loved her from the start because she has been so good. And I did pretty well with the chemo. I basically it took about 3-4 hours for them to infuse it. Everybody was so nice in the room. And then after I got all my chemo drugs, I would go home, and usually about 3 or 4 days out from that, I'd start really feeling the effects. Very tired. Didn't have the nausea, which is so wonderful because I was really afraid of the nausea. Everybody has been just extremely nice. I feel confident in the knowledge that everybody has. I mean, UNC has always been known as a wonderful hospital. I mean, this is where people go. I mean, I'm just so fortunate that I live only an hour away. People will drive, people live in other states, drive here to come to Chapel Hill. And I've had Dr. Van Lee that did my surgery. She is just wonderful. I mean, she's not only a skilled surgeon, but she has a wonderful bedside manner. She talks to you. She makes you feel comfortable. Anytime I had concerns, I felt very comfortable talking to her. And although she wouldn't tell me what to do, I could kind of tell by the way she would talk about it where she was leaning. And that made me feel a lot more comfortable. Ann Dunlap, who is the nurse, she's been great too. She's just the most comforting person. She's the perfect person for the job that she does because she really makes you feel okay with everything that's going on and not have the anxieties. They explain everything to you. Pat Butterton, same way. She's been the one I've been seeing when I've been having this PARP trial lately, and they just I just feel really good about the way I'm being treated, I guess, and that to me is a huge thing because I know you can go to places and people you're going to have good doctors at several different places, and they are wonderful doctors here, but then the fact that they are so caring and you feel like they actually really care about you is what makes a big difference to me. I've been very fortunate that I've had wonderful family support from my family, my friends, my neighbors, my church family. I've had a tremendous support throughout this whole ordeal so far, and through the power of prayer, I have had no anxiety this whole time. I can't even explain it. It's just a wonderful feeling that I've been able to deal with this horrible tragedy without any anxiety at all, and I know that's all due to the power of prayer. I guess what I would recommend for others is listen to your bodies, know that when there's something that's unusual, definitely investigate it further. It's better safe than sorry. If it turns out to be nothing, then great, but I would try, and sometimes I wish I had done this more myself, is just to go the extra step and follow through and make sure that if there is something that's just not quite right with your body, that you have it investigated.